Welcome. I'm Laura Kopek, and I'm a traditional naturopath and functional provider. And today we're going to talk about the difference between functional and diagnostic testing. And I'm going to give you some examples of some functional testing so that it might inspire you to consider seeing a functional provider as you optimize and are on your health journey. So let's begin. All right, here we go. I'd like to start with what is healthcare. I mean, really, we call it healthcare, but it's really disease management. And sometimes it's acute disease management, and it really has its place. But for the most part, under the model of disease management, we're looking at symptom intervention. I mean, certainly you'll have a bacterial infection and an antibiotic, and then that's resolved. Or we're talking about something like heartburn, where the actual cause might not be considered, and the recommendation is an antacid, where that's just going to keep somebody comfortable. So in my idea of healthcare, it would be looking at corrective. It would be looking at balancing the unbalanced. It would look at optimization of a person's health. And then it would also look at preventative, how to craft a plan that would allow somebody to maybe avoid having an acute issue where they have a diagnosis. That's my version of functional medicine. So I also take a lot of pride in being an educator. And as an educator, I like to make the information as simple and as understandable as possible. And I do a lot of analogies. So diagnostic, traditional, modern medicine, we could kind of consider it the plumber, right? But the problem is we're often going to the plumber and asking them to take a look at our electrical panel. And it's not really fair. The expectation that under a diagnostic model, we might always get the right solution for the right problem. Functional medicine, I like to think about more as electrical, looking at the wiring that is running through the whole house. And your plumber may also have training as an electrician, right? Your doctor that understands diagnostic medicine and is trained in that may also have functional training. And then that's, you're kind of getting that all in one. But really, I think it's important to understand that for the most part, they're two different arenas, and maybe we should have both. It doesn't have to be under that single person, but we're putting together, a plan for ourselves. Yeah. Okay. Under diagnostic testing, I think we need to look at, is the expectation to fix the problem? Because really under diagnostic testing, it's to rule out whether there's a real crisis, and it's to give it a diagnosis. And having a diagnosis has its pros and cons. I think sometimes there's this assumption if we get the diagnosis, we have the answer, and then that means we may not do anything to fix the problem. But also, what if diagnostic testing doesn't reveal anything? I mean, I see this a lot. People come to me and they're like, my doctor says nothing wrong. My labs show nothing is wrong. And then we do functional testing and there's so much going on. What does your doctor do in that moment? They may be a little bit more dismissive about what's really going on. And you may feel that you're not really being heard. But the reality is in that moment, you're asking the plumber to take a look at the electrical panel, tell you what's wrong. So what do you do in that moment? Again, if we have a better understanding of the difference between the two, the specialties of the two, we can kind of understand how we're supposed to navigate our health so that it really is healthcare, because we're caring for our health. I think functional testing has its place too. The cons of it, it's not meant to give a diagnosis. It doesn't do the job of diagnostic testing. So if you're doing functional testing and you're just doing that, you're looking at optimization. You're looking at how to address a chronic imbalance that doesn't maybe have a diagnosis or does have a diagnosis, but the corrective strategies are not apparent or available. Like heartburn, again, for example, again, you might have the diagnosis. Do you have all the information you need to address a chronic issue, to look at if it's creating a systemic problem? How do you optimize? And I think the beauty of functional testing is really the ability to customize, to really look at what is going on in an individual, because person A with heartburn might have other underlying issues to person B. And so the strategies, there might be some overlap, but there also might be a lot of differences that help that person really resolve their issue. This is one of my favorite functional panels. This is called the GI Effects Comprehensive Profile. My favorite of this version is the 3-day collection. This is put out by a company called Diagnostics. And you can see from the cover page, there's a lot of looking at the function, right? That functional testing, we look at the function. So it's looking at categories of maldigestion, infection, inflammation, dysbiosis, which is kind of a fancy word for imbalance, and metabolic imbalances. So within those categories, there's a deeper dive into the issues as well. Here's another page off a sample report. They're looking at here, right, the sheer numbers and abundance of organisms in a person's gut. Is there too much? Is there too little? And one of my favorite things on this page is looking at methane gas. So if somebody's methane is too high, it may be the reason why they're gassy, bloated, or having an issue with certain foods, really confused about what they can and can't eat. It also could be a problem with a baby nursing and moms having digestive issues, and some of them are affecting babies' digestive function. This page is also looking at intestinal barrier function. Sometimes this is kind of called intestinal permeability, leaky gut. That was a really popular term given a number of years ago in functional medicine. I love that we can really look at it. I don't like to make a generalization. I think this was an overused term for a while, and being really able to test for it, I think, is important. This is probably my favorite page on this report, because again, it's really looking at function. Is a person making enough digestive enzymes? What's happening with their stomach acid and breaking down protein and fats? Could there be a need to run an allergy panel because they're struggling with food allergies? Could there be a gluten intolerance here? And in the metabolic section, there's like a pre-risk for colon cancer. I think this is fantastic if you're optimizing, there's a family history, why wait until there's cancer cells? Also looking at short chain fatty acids, these can really affect people's skin, eczema. It can affect the way that people are metabolizing fat. So a lot of really fantastic information here. And then also looking at infections, right? Looking at, is there enough good stuff? And then is there too much of organisms that we need to cohabitate with to keep that active working gut environment? But if those get overproduced, they're excess, they're going to lead to a lot of inflammation, a lot of symptoms. So kind of really knowing what those are, so there can be, kind of a strategy and attack plan to resolve it, is a really great thing. Okay, moving on. The Nutra-Eval. This is a really common test used by functional providers. It's probably one of the more popular ones. I think it's a fantastic test because it really does a deep dive in a way that diagnostic testing won't do. So you can see here, there is a ton of information that is looked at here. Acids that fall under oxidative stress, nutrients and acids that fall under mitochondrial, omega imbalances, toxic exposure, Is this a problem? Is this overwhelming how the body is detoxifying? And then methylation. So really, really cool. What you can get from this test is looking at nutrients that you might not get done in traditional lab work. And then this really kind of helps you again customize and go, well, how much do I need? And working with a provider that looks at your need also versus the way you're absorbing it, so that things that build up and can become toxic to the system, you're not just going off the need overview, that your provider is looking at how everything integrates together, so that how you meet these needs isn't just a narrow picture either. Okay, what's inflammation? I mean, that term is used a lot. Really, what you're looking at is kind of a snapshot of inflammation, because when nutrients are not in balance or absorption is off or there's infection, then some of these acids, these levels climb, and then that really is inflammation. So looking at it in a very comprehensive way, again, can kind of help a person understand what's going on in their body. And some of these markers are really indicative too of diet and nutrition. So from here, I'll look at, what foods aren't really being, the right fit for that person. Hands down, this is my favorite functional testing of all time. I've been waiting for a functional test like this for a really long time. I think everybody, every adult should have this. I think every female 12 and up should have this done. I think women's health especially is incredibly complex. We're seeing much more teen anxiety and depression than ever before. And, when you go to your doctor, even if you decide you're going to go down the pharmaceutical route, do an antidepressant, how do you know which one you need? Looking at your neurotransmitters. And, when I look at this, I'm also, again, integrating and mapping it together. If somebody's progesterone is low, that's something that might be done in a diagnostic arena. But what if there's a functional cause to it? What if it has to do with cortisol? And then what if that has to do with neuro? And what if there's a dietary component in this? Or what if it's just a nutrient that's been missing? I mean, it's so amazing to me that we could look at mental health in this way and look at women's health. There are so many women that are assuming that they're having a hormone issue, and they may not have a hormone issue, or it may not just be a hormone issue. This is gaining some popularity, but the reason I put it in here, I don't really do this test very often, but the reason I put it in here is that it definitely needs to be talked about, because it's very trendy right now to talk about mold toxicity. But really, when I consider mold toxicity, I'm really looking at somebody's detox pathways. Like, I find the other tests to be much more insightful, because the reality is a lot of us are like, it's just pretty common to have mold, especially if you live in places where mold is just a part of the environment. And, like this test here, this sample report, there's very little mold toxicity going on in this person. And it's more important to look at the pathways and where the burden is on the body, and using this as a piece of the puzzle. It's a very expensive panel. So very rarely do I really see somebody who has mold toxicity and really warrants this being done and kind of doing that intensive work. Okay, here's a little case study for you, a sample. Woman was nursing, and her first symptom, she went to her GP. The GP found nothing unusual in diagnostic testing. All her labs came back normal, prescribed thyroid medication anyway. And then the symptoms persist. So this individual went on to see a different doctor. And the second doctor prescribed an antidepressant. Did not review the combo of the two medications, and didn't find out whether or not those recommendations can be taken during nursing. I think this is a concern. So anyway, the person finds a small amount of relief, doesn't feel 100%. So now they come and see me. In their first functional visit, I recommend the HPAG panel to determine whole body health, and the results come back and reveal low neurotransmitters, but they actually don't match the antidepressant that this person was taking. And there was also a cortisol issue that wasn't going to be resolved with the antidepressant. So this is new and empowering information that she received from doing that functional test, having that functional review. She had a much more comprehensive understanding of her body. I recommended things she could take while nursing. It's just a much different approach, much more empowering. So, as Walt Disney said, the way to get started is to quit talking and to begin doing. I love that we have medical freedom. I think this is all your choice, and the combination or the pursuit of wellness falls to you. And I think that that's exciting. And, sometimes you might need to get a diagnosis. But I would encourage you to be careful if the diagnosis causes you to give up. Well, this is what I have. There's nothing to be done. A diagnosis should empower you. It should help give you a sense of, this is what I have, but don't stop and consider it the finish line. There's a lot more that can be done. Or if you don't get a diagnosis, don't feel like there's nothing wrong. But again, in the diagnostic model, you're given the choice that you can take medication that will often manage symptoms. It won't resolve them. And then what happens is a lot of people continue to add medications as the issue becomes systemic. And so again, if you want to have more understanding about what's going on, you might want to consider other different kinds of alternative practitioners. If you see integrated or holistic, symptoms are going to be addressed with natural support. There's certainly not those side effects. If the natural support is the right fit, the underlying cause may or may not be addressed. Take constipation, for example. Under the diagnostic model, you may even be recommended an over-the-counter milk of magnesia. In the integrated or holistic model, an herb might be used to relieve constipation. Again, that may not be corrective. In the integrated or holistic, you might also be recommended something like that. It just kind of depends on the style of the practitioner. In a functional model, it should be about getting to the cause. It should be about looking at, well, what's causing the constipation? Is it high methane? Is it low stomach acid? Is it a combination? Is it infection? Is it low magnesium? Like, what are all the factors that kind of become the problem? And that's where functional testing comes in. It really is about doing that deep dive and then mapping what's going on. Now, if you see a functional provider, you may or may not get functional support. Again, it's going to be according to the style of the practitioner. My feeling is if you really don't get that full complete, you may just be getting a partial kind of functional. You may get functional testing, but not really be working with a functional provider. So again, as part of the education I do, I think it's really important that you kind of understand so that you can make really good choices for yourself. All right. Well, this is an opportunity for you to pursue functional testing with the provider of your choice, so you certainly could see me. And at the very least, I hope you tune into my podcast and subscribe to my YouTube channel. Thank you and have a great day.